Thank you, Mr. President. Thank you, councilors, and I appreciate your invitation. Milford Cares encouraged me to come here tonight, and I've got to say I understand that we agree on our position, and I ask your respect for our elected officials tonight. I'm Jody Hensley. I'm visiting from Westboro, and I was an elected school committee member and a chair there for 6 years, and now sit on our town's advisory finance committee. So I both know what it's like to sit on your side of the table and take tough votes, and I appreciate your service to your community. I was asked tonight to cover some information on public health facts and impacts around marijuana legalization and commercialization, to talk a little bit about the national scene and what's happening in early adopter states for marijuana commercialization, talk a little bit about statewide facts, tell you about our Westboro experience since we were the first community in the Commonwealth to opt out under the provision in the original mass marijuana law, and to talk about revenue and revenue misconceptions. I have learned more about marijuana policy than I ever wanted to know in the last 5 years since I've been working and researching on this. So I've given you each a packet selecting some of what I thought might be useful to you as you deliberate and make decisions with and for your community. So I'll go through them. I'm going to read to you a little bit about the Westboro opt-out experience and let you know that I had followed the marijuana industry efforts to commercialize this drug for 5 or 6 years. I got active when my son was in high school, and I came on to the school committee and looked what was happening with perception of harm among young people. Saw the marijuana campaigns coming. I'm a political scientist by training, so I got very curious about what was going on, and I dug in and studied the impacts of marijuana commercialization, particularly in Colorado and Washington. I observed the impacts of social norming on youth attitudes in prevention science, in addiction prevention science. We have learned that where the supply and availability of a drug goes up in a community, and where the perception of harm goes down, we see use rates going up, and when we see use rates going up and heavy use rates going up, we see increases in addiction. So early use primes that brain for addiction. So I come out of the industrial environmental protection world. I worked for 20 years to try and get toxics out of our communities and consumer products. This is very much the same area of policy. So this drug is also still illegal under federal law, which creates a legal quagmire in the states that are jumping into legalization and commercialization. We have to put together the frameworks at the city level and at the state level, and without help from the federal government, because the drug is still illegal federally. And the Supreme Court has ruled that federal law preempts state law in this area. So if we come into conflict and any of our case law goes to the Supreme Court, it's very likely that federal law will still trump state law. So it leaves policymakers in a very uncertain place. So as elected officials, my husband was chair of our planning board and our economic development committee before I became chair of the school committee. So he was tasked with making policy around medical marijuana in 2012. Our community was a no on question 3 in 2012, yet we had to make policy about that. So he did his research based on some of our mutual past history and made policy around something called the Precautionary Principle in public policy. And that means in matters where there are disagreement on the evidence of harm to community or health, local decision makers should act to do so as to do the least harm. And later in your packet, I gave you a paper on the Precautionary Principle, and you can do some reading about how that might apply to marijuana policy at the local level. In terms of economic implications, we decided that in our community that the marijuana industry would run counter to our community's brand as a safe and healthy, kid-friendly community, and that some revenues are simply not worth taking. Are we a compassionate community? Yes, we are. And we know that individuals are free to use this drug in Massachusetts, unmolested, unharassed, unarrested. But we are also the home of Spectrum Health Services, a pioneer in therapeutic communities with a long tradition of supporting treatment and recovery from addiction. And Spectrum's leadership helped us in our efforts in Westboro. And we also are home to a secure DYS facility, which helps teenage boys and girls in custody make positive gains and changes in their life outcomes for the better. Regular programming there includes counseling for substance abuse treatment and relapse prevention, and we prefer to be a community with fewer triggers for relapse. So how did we opt out? We opted out as early as possible. We were a no community as well. We voted no on question 4 by about 6 points. But I was one of the people in the state who had read those 8,490 words of a law written by marijuana advocates that was put on the ballot for average citizens to vote on, and had found that small provision, complicated provision, about how a community could opt out from a new state mandate that communities support and promote marijuana sales in their city or town. So we went to work on that in January of 2017 and opted out in March of 2017. Well, in the statewide election, we had a 6-point margin defeating Q4. We went with the original 3-step process to opt out. We had a ballot referendum on opting out, much like your ordinance. Then we took it to our town meeting floor, where we voted on both a zoning bylaw and a general bylaw, because the law is so confusing that our attorneys suggested that we do something called a belt and suspenders approach and vote on both a zoning bylaw and a general bylaw. We know that the zoning bylaw requires a 2/3 vote and the general bylaw requires a 50% vote. Cities and towns now we have a city and town this week in Massachusetts voting on a general bylaw because they believe that a simple majority is enough for a local legislative body to opt out. So what happened when we took it to our folks, we had an 80% affirmative vote to opt out on commercial retail sales, manufacturing, cultivation, and testing. And on town meeting floor, we had an 86% support of the zoning bylaw and about an 87% vote for the general bylaw. So the lesson we took away is that voting in your community on marijuana legalization as a concept, which generally means we don't want to throw people in jail for using or possessing marijuana, is very different than the idea of hosting and promoting marijuana commerce in your own hometown. So that's where we ended up. We also strategically opted out early because we knew if we didn't, a highly organized marijuana lobby would be working cities and towns and town councils to try and offer incentives to open more marijuana commerce at the local level, and that's exactly what's happening now. Cities and towns that are waiting longer to make this decision are getting more pressure from the industry to allow commercial, non-medical marijuana commerce. So the rest of my talking points are there. You can take a look at our experience, and we feel good. We adopted local public policy that includes strong protective factors that are typically associated with the decreased likelihood of substance use and abuse, and we feel good about that as local policymakers. We also know that nothing is permanent. If somehow we become really interested in hosting marijuana commerce in the future, we can always revisit that and entertain an option in the future. But out of an abundance of precaution, we decided to protect our citizens now and leave our options open in the future. The next thing in your packet is just a few slides I put together here that I think have become very important messages for cities and towns and local leaders to know. Marijuana is not a harmless drug. There has been an industry narrative that has been sown for over 20 years now, and that the fact its harmlessness is not supported by science. And the promotion of the drug, much like tobacco was promoted for almost 15 years, is being repeated in order to normalize the idea of use, so there is more use, and for speculative commercialization. The idea of making lots and lots of money selling lots and lots of cannabis is driving a lot of people into this market. So we need communities and leaders to be aware of what the pressures are to increase supply and use of this drug. What is supported by science? Marijuana commercialization is associated with higher rates of both youth and adult use, and it's becoming a more potent drug. And one of the most concerning factors is that in the last 10 years, heavy use of the drug has almost doubled. And it's heavy use of a more potent drug than we saw in the 20th century. So some of the the risk factors that accompany heavy use. There are issues with attention, memory, and learning, poor educational and life outcomes, reduced IQ for persistent heavy users, potential for addiction to marijuana, and increased risk of addiction to other drugs, increased risk of psychosis, and possibly suicide. And none of this is controversial science. This is mainstream medical science now. You can talk to any psychiatrist, you can talk to any family physician, you can talk to any addiction doctor, and this is routinely known in medical fields. We just need the public to know it. And as you work through this slide, you can see some of this, what's happening to the drug as we move into commercialization. There are over 70 cannabinoids in the plant. THC is the cannabinoid that has psychoactive effects. That's what gets you high. That's what's considered the hallucinogen. CBD is a countervailing ingredient that has some potential to relieve spasticity in certain medical conditions. That's the medical component. But what's happening with the commercial drug is THC levels are rising dramatically and the countervailing CBD levels are remaining flat. So there's the science on that. And what we are learning in the early experiments is that where there is more pot, there is more use. Marijuana use disorder this last year has been included and defined as a psychological disorder in the DSM-5 manuals, and the New England Journal of Medicine has been very clear on the outcomes. I give you a few pages of graphics that show that where there is more marijuana availability, use rates are higher. It comes out of the Healthy Kids study out of Colorado. We're giving you graphics of where there are concentrations of marijuana outlets and where higher use rates appear. Those, the data overlays with one another. And some of the national ranking of the states, you can see that where we're comparing states where marijuana is not legal, states where marijuana has been medicalized, and states where marijuana has been legalized. And you can see that the use rates among all age groups go up as you commercialize. Colorado, sort of a pioneer in this, went from hovering around 7th or 8th in the country for use rates to the #1 state for marijuana use and exposure across all age ranges. So the next slide we have here is a summary of the New England Journal of Medicine's findings about the evidence, strength of the evidence for adverse effects of marijuana on health and well-being. And you can see what's at risk: addiction to marijuana and other substances, abnormal brain development, progression to use of other drugs, schizophrenia, depression or anxiety, diminished lifetime achievement, motor vehicle accidents, symptoms of chronic bronchitis. That's what can happen when a user gets in trouble with marijuana use. And we'd like to see less of this happening. It's not every user. Not everyone who smokes cigarettes dies of lung cancer, but 450,000 Americans die premature death because they smoke cigarettes. That's not all of the smokers, but that's too many of them. We'd like to see less of these health effects and not more. So what has happened in Massachusetts is 91 communities last fall were voted no, and under the marijuana compromise in the legislature last summer, communities that voted no can proceed right to their legislative body to basically, you've been enabled to enact the will of the people. So far, over 100 communities in Massachusetts have either opted out with temporary or permanent moratoria, and I think over 35 communities have opted out on the state law's mandate to host marijuana commerce already. I've given you information on the precautionary principle and the reasons Westboro opted out. We found out that we discerned that hosting and promoting commercial, retail, and non-medical marijuana was not compatible with our brand as a community. It was not compatible with our community values. We wanted to promote drug use prevention rather than drug use promotion. We thought that the revenue was not worth taking, and as elected officials and policymakers, we asked ourselves, on what side of this issue do I want to find myself in 10 years when all the evidence comes rolling in? So I just encourage you to follow our example if you find it in your conscience to do so. I put one slide together on our position on revenue. We found that some revenues are not worth taking, and we looked to CVS Corporation, which gave up $2 billion per year of a revenue stream as a corporation. That's $2 billion with a B, and they discontinued selling or providing tobacco products as a corporation. They found, and the reasons they gave is it was not compatible with their brand as a healthcare company, and it was simply the right thing to do. We consistently find that the social expenses of addiction for product income streams, we have social expenses that end up exceeding any public revenues from that drug. Amherst did a back-of-the-envelope estimate of the social costs for their community, and they estimated it will cost $550,000 in additional costs in Amherst, Massachusetts annually if the marijuana industry takes root there. Rhode Island did a statewide cost analysis. They came out with any potential marijuana revenues, the costs would run at 119% of any potential marijuana revenues for the state. So also for your consideration, I added, we have a neuroscientist on our team, PhD neuroscientist up in Ashland, who's also a mother of 3 kids and runs a prevention coalition up there. She's given you some hard science on the facts of marijuana and adolescent brain development, and also the impacts of lax marijuana policy on communities and in general. And let me see, I told you we gave you a plausible risk in considering of medical marijuana uses and commercial marijuana uses. And also, finally, I included a list of links that I sent to Senator Elizabeth Warren's office when I met with their staff last January. This is a 4-page list of links that can bring you up to date on the science and impacts of the marijuana commercialization experiment. Finally, the last link that I provided here came from Mark Kleiman, who's a PhD drug policy professor at New York University, and for 30 years has been working on marijuana legalization policy. This has been his pet project. He's wringing his hands now. He wrote an article called "We're Legalizing Weed Wrong." And this is an article that's 8 or 10 reasons why we're legalizing. The ballot questions that are passing are not what he ever had in mind. He didn't want people going to prison or being incarcerated for their marijuana use, but he certainly didn't want to create an addiction for profit juggernaut similar to tobacco. And his opening line for this article is cannabis like alcohol, regulate cannabis like alcohol is an ugly policy. Our current alcohol law fails spectacularly to control the harm that it does to drinkers and the harm drinkers do to others. An estimated 90,000 Americans die each year of their own drinking or someone else's. Why repeat this mistake when we legalize another potentially habit-forming intoxicant? And he goes on for 7 more pages with a lot more detail than I could ever provide. On the back of that handout, I'm giving you statistics about what happened in Colorado where they now have more marijuana businesses than McDonald's or Starbucks, and pointing out to you that Massachusetts was the first state in the nation where the marijuana industry wrote a law for us that captured 351 cities and towns and brought them into play with the marijuana industry, requiring every city and town to jump through hoops to get out of that state requirement. In the first 4 states, cities and towns had to opt into marijuana commerce. So what happened in Colorado and Washington was that 70% of municipalities never entered into marijuana commercialization. So they're running number 1 in the nation at consumption rates, while 70% of their communities have opted out and don't participate in the market. So thoughtful local decision-making is very, very important, and we need to support local leaders who recognize that and support their communities and put public health before marijuana profits. So with that, I thank you and I'm willing to answer any questions you might have. Thank you.
Ms. Hensley. Ms. Wood.
I'll ask. Thank you for the information. It's all good information. The towns around you, all didn't vote no, right?
Right.
So where do you think they're going with being a yes vote? Where do you think they'll go with retail, and how will that affect your town?
As they are yes?
Yes.
If they don't organize to do the 2 or 3 step opt-out process like Westboro did, they're much more, and if they don't pass restrictive local policy, they're much more vulnerable to becoming a marijuana center, to having proliferation of marijuana outlets, and all of the public health indicators go in the wrong direction when marijuana outlets proliferate in a community. So that's what I think is at risk in the towns that choose not to opt out or severely restrict commercial retail marijuana activity.
So Framingham is pretty close to you, right?
Yes,
And it was a yes town.
yes,
And they're likely going to have retail outlets.
yes, they are.
So your ban in Westboro,
Hmm.
while it becomes inconvenient, does not make it impossible for the citizens of Westboro to get marijuana.
We're very realistic about that. And no one in Massachusetts has any problem getting marijuana. It's now legal for you to grow 6 to 12 plants in your own home and consume in the privacy of your own home. The question you're being asked as a local leader is, what kind of message do you want to be sending to the people of your own community about supporting and promoting the marijuana industry? That's the position we have to take as public leaders, and that's what we have to go on public record voting for. Do we want to prevent or promote the proliferation of the cannabis industry in Massachusetts? I was pretty clear on where I wanted to be.
Right. Thank you for coming in.
You're welcome.
Thank you, Mr. President. And thank you very much for taking the time to come to Bridgewater tonight from Westboro. I appreciate it.
Thank you,
And
Mr.
this was a
Gallagher.
great presentation. It's more information that we have listening to the citizens every week, because we yet, as a council, have really haven't had any discussion of what we're going to do. And tomorrow
Sure.
will be 1 year since the vote took place.
Mhm.
Of the 91 communities that voted no, and we are one of them,
Mhm.
do you know of any of those no communities went back to a ballot or are considering going back to a ballot instead of making the decision legislatively, which they have the authority to
No,
do?
I've never heard of any other community abdicating their responsibility to move forward on the vote of the will of the people.
Okay. And of any yes communities, do you know if they're going back to a ballot? Do you know of, or
You know what? There are 100 communities that have passed moratoria.
more?
Milford was a yes community that took it to the ballot and voted to at the ballot to prohibit pot shops for a total ban by about 58 or 59%. Now, when they brought that back into representative town meeting, the marijuana lobbyists and their attorneys had come back and commandeered floor action in the town meeting to change the vote so that they will not be having a total ban, they will be restricting.
Thank you. That's all I
You're welcome.
No other questions. Thank you very much.
Thank you.
Appreciate you taking the time.
Thank you.